This is the webinar presentation for Feeding the Soul Online World Summit 2016 by Dr. Regina Hess, Cologne, Germany, with the title A Heart Blown Open, Relevance of Altered States of Consciousness, Endogene and Exogene Induced, and Psychoactive and Empathogene Assisted Transpersonal Psychotherapy, Implications from Research and Practice. Hello around the globe, Selam, Hola, Guten Tag, Ciao, Salut. A very warm welcome to all who participate in this webinar and thank you so much for your interest. I will talk you through this PowerPoint presentation and start with a brief outline of the table of contents. I will give you a brief philosophical framework of transpersonal psychology and research as the basis that I'm drawing on. I will outline definition, classification, stages of altered states of consciousness. I will describe exogene and endogene induction of substances and methods. We'll give a historic overview. We'll explain general mechanisms of the effects of endogene-exogene induction. We'll outline influence of dose setting and risks, medical indications, contraindication, and current research centers. We'll give you a little visual photo tour of pioneers in the field. And we'll then go into one specific example of current psychedelic research, clinical MDMA research, state of the art, as an example for the relevance in transpersonal psychotherapy, some recommended literature media, and a tiny conclusion. The philosophical framework that I draw on is transpersonal psychology, in particular the concept of interconnectedness that assumes everything is interconnected and impacts each other, moving beyond ego, all-encompassing, integrative, such as published in Friedman and Hertelius 2013, Anderson and Broad 2011, amongst others. All dimensions are acknowledged, worked with in therapy, and addressed in research, such as the dimensions body, mind, spirit, socio-cultural, transgenerational, transcultural, on the levels of emotions, of psychosomatic experience, interpersonal, spiritual experience, and the dimensions of nature, ecology, cosmos. It includes also studies on consciousness and expanded states of consciousness. Classification of altered states of consciousness. For example, Stanley Krippner, published in John White 2012, defines altered states of consciousness as an expanded mental state recognized by the individual as different to normal waking state. Krippner, for example, classified about 20 different yet overwhelming states of consciousness, such as sleep, dream, normal waking state, coma, meditative, daydream, lucid dreaming, expanded states of consciousness. The classification, they can occur spontaneously or induced. Induced exogene altered states of consciousness can result through perception flooding, such as a rave or techno party, hypnosis, trance, through drumming, dancing, singing. Also includes dehydration, or can include dehydration, fasting, sex, etc. Can occur through substances and in particular through induced endogene, so-called endogene body internally produced psychedelic substances, DMT, will give feelings of flow, can be induced through extreme experiences such as underbirth for mother and child, near-death experiences, severe accidents, disasters, etc., or induced through certain methods such as prolonged darkness meditation retreat. The darkness room meditation retreat is used in many different religions and also in shamanic traditions. Here's one picture, for example, of the dark room as it's used in Tibetan Buddhism, where the monks have to stay 40 days in these darkness chambers. That leads to prolonged darkness, leads to internally released endogenous DMT. Rick Strassman is kind of the pioneer and so far also the only one who did extensive research on this phenomenon of how endogenous DMT might be produced and where it is produced, pointing to the pineal gland, and has support for some of his hypotheses, but it will need much more research also from other researchers. Stanley Groff developed a cartography of stages of non-ordinary states of consciousness, also based on his extensive work in holotropic breathwork. He differentiates the four stages, including sensory, biographical, perinatal, and transpersonal. In the sensory state, the person will have a lot of different sensorial perception experiences in the body and outside the body. Biographical material that can or will come up during altered states of consciousness, depending individually on the story the individual carries with him or her. Perinatal experiences and imprints that are activated through such altered states of consciousness, and material can come into consciousness. And the transpersonal level, where collective unconsciousness material can rise into consciousness out of body experiences that can bring such material and archetypal memories, archetype experiences of other spiritual transcendence, experiences of time, of places, mystical experiences, peak experiences, experiences of oneness, of void. A brief history of altered states of consciousness. It has been used throughout history in all shamanic traditions around the world. For example, also in religious traditions such as dark room meditation as an endogenous induced psychedelic experience. Oldest mushroom cults approximately 10,000 BC, early peyote cults approximately 4,000 BC, ayahuasca since approximately 3,500 years. Then on the other side, also endogenous induced altered states of consciousness, for example, mysteries of Eleusis in Greece about 2,000 years old. Then in the modern era, chemically synthesized produced psychedelic substances such as mescaline by Beringer 1927, LSD by Hoffman 1943, LSD in psychotherapy by Leuner 1962, MDMA 2CB by Shulgin 1965. It has been also used in indigenous religious cults and churches such as the Santo Daime, to know many of you. The mechanisms of the effect or impact of the endogenous exogenous substances. Regarding the entactogens or empathogens, they are called heart opening, ability to connect, to bond, increasing trust, substantial freedom of fear and anxiety, enhanced self acceptance. And psychedelics, also including endogenous release of DMT, are described as support awareness, consciousness awakening. They are described as opening the doors of perception and consciousness, opening unconscious area of the psyche, becoming conscious, operate like a magnifier, reduce thresholds, barriers of perception, reduce filter functions of the brain, and the experience is additive. Entactogens means bonding from within, willing to touch from within, or also called heart openers such as MDMA, ecstasy, street drug. This will be the later focus of this presentation related to clinical research. Psychedelics include, for example, LSD, psilocybin, ayahuasca, ketamine, ibogaine, mescaline. There are also several publications dividing a psychedelic experience in different stages. One very prominent publication is the so-called Death Psychedelic Experience, a manual based on the Tibetan Book of the Dead. This version of the Tibetan Book of the Dead was also authored by Timothy Leary, Ralph Metzner, and Richard Albert alias Ramdas, all of whom took part in experiments investigating the therapeutic and religious possibilities of drugs such as mescaline, psilocybin, and LSD. The book is dedicated to Aldous Huxley and includes a short introductory citation from Huxley's book, The Doors of Perception. There's also a good summary of the book available as a YouTube video clip, worth looking to just get a brief impression of such a journey and experiences. It is important to look at potential damages of such substances, and not does and did and still doing important research comparing the impact of substances. On the very left, the highest potential of damage is alcohol, followed by heroin, and the lowest potential of damage is with mushrooms, and also in this very low area is, for example, LSD. Impact variables of exogenous or endogenous induction that are important to look at: the substance itself, the effect of the substance, and of course the purity, especially when they are chemically synthesized substances. The set, the personality, the mood, intention, also cultural, religious background, and the setting, safe space, trust to the therapist or to the There are different dosages, microdosing, quiet or walk at the moment, enhancing creativity and insights. Low dose, also often used for problem solving, also to enhance creativity. Medium dose is especially used in the European area for therapeutic use and is called psycholytic. High dose is for spiritual opening is called psychedelic and is widely used in such a dosage, for example, in the USA. Medical indications, there's quite a bit of research going on and pointing to different indications. For example, for post-traumatic stress disorder, MDMA shows groundbreaking results. For terminal cancer patients, LSD, psilocybin. For addictions, LSD, ayahuasca, ibogaine. Further indications, for example, cluster headache, brom, LSD, major depression, ketamine, Morris Parkinson, obsessive compulsive disorder, psychotherapy in general, developed by Stanislav Grof, LSD psychotherapy, and special permission. Swiss Medical Association for Psycholytic Therapy could do psychotherapy with LSD from 1988 to 93. Contraindications and risks. Exclusion criteria: manifest psychosis or disposition for psychosis, severe heart and or bloodstream problems, liver and or kidney disorders, epilepsy, pregnancy, and for adolescents. Current leading research centers include MAPS USA, Johns Hopkins University in Baltimore, Maryland, Hefter Research Institute in San Francisco, ERI, also San Francisco, California, SEPT, Switzerland, and ICERS, Barcelona, Spain. You can all find them easily on the web and see about their research, publications, and information provided is vast. A tiny photo tour to give you some visual inspiration and stimulation. This is the early Albert Hofmann discoverer of LSD. This is the late Albert Hofmann. He died with 102, and his wife Anita, who died with 95. They were married for 73 years and have 3 children. Alexander Shulgin, Russian-American biochemist, and his wife Anne from New Zealand, US. He is the so-called godfather of psychedelics regarding psychopharmacology and psychotherapy. He developed 2,3-B MDMA mescaline in chemical synthesized form and integration in psychotherapy. Hans Karl Lohner, founder of the European Medical Association for Psycholytic Therapy and was professor at the University of Göttingen. Stanislav Grof from Czech Republic, and LSD psychotherapy and research and holotropic breathwork. Walter Pahnke, famous Good Friday experiment psilocybin study religious experience, was his PhD thesis at Howard Divinity School, supervised by Timothy Leary and Richard Alpert. Roland Griffiths, US, also like a godfather of psychedelic research, especially related to psilocybin. He works with Johns Hopkins and Hefter Research Institute. Rick Doblin, founder of MS and researcher and groundbreaking pioneer of moving the field forward since the 80s. Peter Gasser, MD Switzerland, Director of the Swiss Medical Association for Psycholytic Thorsten Percy, Germany, is a German scholar and researcher. Michael Mithöfer, MD USA, and his wife PhD. Annie PhD, they work together as a couple in MDMA assisted psychotherapy with chronic therapy resistant PTSD. Regina with Michael meeting and networking in Barcelona. Also networking with colleague Carlos, pioneer in psychedelic research in and with a colleague at the SEP conference of the Swiss Medical Association for Psycholytic Therapy 2015. I now move on to the specific example that I want to explicate here in this PowerPoint presentation about current clinical research with MDMA, with individuals who suffer from chronic treatment resistant PTSD. That also should be an example to show the relevance of psychoactive entactogen assisted transpersonal psychotherapy interventions and implications from research and practice. I start with a tiny MDMA history just to give a brief overview. MDMA was developed in 1898 in Germany as a parent for other chemical substances. 1912, Merck Pharma Germany got patent but did not use it further. 1950, a colleague Brevde in Russia recovered it and re-explored it in Cold War times with army soldiers as honesty drug during interrogations. 1965, it was revived again through Alexander Shulgin. At that time, he was living in the Russian underground, also with Leo Zev, and also on the other side of the globe with Claudio Naranjo. 1980s, a wave as street drug and party drug at raves, techno parties, etc., which led to 1984 illegalization in USA through the FDA. FDA is Food and Drug Administration in the US who regulates drugs. 1999, MDMA research in Barcelona starts under Professor José Carlos Brusso. And 2005, clinical MDMA research starts with Michael Mithöfer et al. Also, for example, now currently with Peter Urin via MAPS MDMA research. Current research going on regarding MDMA in individual settings, especially through Michael Mithöfer et al. Peter Urin's MAPS in group settings, for example, studies from Thorsten Percy, Germany, with autistic individual studies in Los Angeles. USA with couples, now a study in UK with healthy volunteers related to psychopharmacological impact, for example with Matthias Lichte, Switzerland. From I will now go into it to just talk you through, for example, one study outline to give you an impression how it is done and, of course, show you some outcomes. Michael Mithöfer et al. Developed a manual based on the findings, MDMA-assisted psychotherapy for treatment of What is PTSD is typically a chronic illness with high rates of psychiatric and medical comorbidity, seen as a disability, includes much suffering, high rates of suicide, and high medical morbidity. The neurocircuitry model of PTSD includes the deficit in extinction of fear conditioning. As a result of overstimulation of the amygdala and under hypoarousal of the prefrontal cortex and hippocampus, an MDA impact shows quite opposite to the PTSD symptoms. It decreases the amygdala activity, it increases the hippocampus and prefrontal cortex activity, and in that way reverts the symptoms of PTSD. Why study MDMA for PTSD? There's a need for a wide array of effective treatment. 25 to 50% do not respond adequately to existing treatment, often related to fear, defensiveness, numbing, lack of trust. MDMA has shown a decrease of fear and defensiveness, an increase in trust and empathy. Also, it can enable affirming experiences, more realistic perspective about present circumstances, and control. MDMA as a substance has a complicated pharmacological profile. I will not go into that, just to show it to you. And the effects show a high concentration of release of oxytocin, prolactin, vasopressin, cortisol, DHEA, and ACT. The study design looks like that. The impact appears after 30 to 60 minutes after ingestion, with a peak effect of at about 1 to 2 hours and lasts from 3 to 6 hours. Volunteers reported heightened senses, slight changes in perception, brightness of the room or colors, sounds, seeming closer or farther, simple visual distortions, altered time perceptions, and changed meaning or significance of perceptions. Only in the window of tolerance, psychotherapy is possible in general and in specific for PTSD individuals. In the hyperarousal zone, which includes increased sensation, emotional reactivity, intrusive imagery, disorganized cognitive processing, therapy is not possible. Also in hypoarousal, numbing of emotions, disabled cognitive processing, therapy is not possible. Only in the window of tolerance, optimal arousal zone, psychotherapy is possible, and this is exactly what MDMA impact seems to be able to produce, that that research participants can stay in this window of tolerance for quite some time during the effect, and psychotherapy material can be processed in a much better way than in hyperarousal or hyperarousal. The study itself, or one study, uh, double-blind placebo-controlled treatment-resistant 20 participants who had have treatment with medication and psychotherapy. Diagnosis of PTSD was crime or war related. Crime was mostly sexual abuse or rape. Must tap off the psychiatric medication before they can start the study. %60 receive MDMA on 2 or 3 occasions, 30% receive therapy with inactive placebo on 2 occasions. And then there's a crossover group where they first receive a placebo and then they receive MDMA. Interview scales are used and symptom scales are used. For example, the famous CAPS for PTSD symptoms. During the impact of the substance in the session, in the experimental session, MDMA or placebo is administered during 8 hours. Male and female therapists are present and overnight stay after the session. Additional non-drug therapy sessions 11 to 15 in stage 1, 9 to 13 in stage 2. Blood pressure, pulse, temperature is measured. Overall, the study setting is like that. 2 introductory sessions and screenings, 3 experimental sessions, MDMA or placebo, 2 follow-up integration sessions, and over a period of 3 to 6 months. The treatment room looks like that. For example, this is Michael Mittervers and his wife's therapy room where they conduct a study. The research participant is on this lying chair. He can sit or lay down, can use headphones with music. The female and male therapists are sitting on each side, giving some prompts, measuring some medical blood pressure, etc., uh, giving some input when needed as intervention. MDMA magnifies whatever is there, affirming, joyful, or difficult, painful. I don't know. This is from research participants' voices. I don't know why they call this ecstasy. It wasn't an easy experience, but it was so worth it. I feel a sense of calm and stability now. I have respect for my emotions now. What's most comforting is knowing now I can handle difficult feelings. This is the CAP score, the PTSD symptom scale. And the red line is the effect of MDMA, and the blue line is this of placebo. It shows very clearly how strongly the PTSD symptoms decreased under MDMA. Then in the crossover group, compared to the MDMA group, in the crossover group, first placebo, not much change in the symptoms, and then with MDMA, similar reduction of the PTSD symptoms than to the MDMA. And they also compared the impact of the dosages, and the 75 milligram MDMA showed the strongest impact in reduction of PTSD symptoms. And in the 12 months follow-up, the symptoms decrease remained the same. I don't think I would have survived another year. It's like night and day for me compared to other methods of therapy. Without MDMA, I didn't even know where I needed to go. Maybe one of the things the drug does is let your mind relax and get out of the way, because the mind is so protective about the injury. Reference for the MDMA studies of Mithöfer can be found on the MAPS webpage easily, and there are also literature review updates, for example by Lisa Jerome, also published on the MAPS website. Two books that can be recommended for clinicians related to MDMA: Through the Gateway of the Heart, accounts of experiences with MDMA and other empathogenic substances, and Healing with Entactogens: Therapist and Patient Perspective on MDMA Assisted Group Psychotherapy by Torsten Passy. And there's currently a movie under production, a documentary, which is called MDMA the Movie, which brings together all the knowledge base that we have to this point about MDMA impact and MDMA use as street drug, party drug, bringing together all the historical information and process of development. I highly recommend that. They now published different trailers, footage from the documentary that you can easily access on YouTube, and they are now in the final phase of production and running a crowdfunding campaign to bring together the final funding needed. So whoever of you feels inclined to maybe support a little sponsorship, that will be fantastic, that they can finish their Paramount movie. Conclusion: so what? Consciousness expansion for what? Working with substances that support altered states of consciousness and integration in psychotherapy for what? Throughout the PowerPoint presentation of this webinar, I have tried to show the importance and the relevance of altered states of consciousness and the use of substances for altered states of consciousness integration in transpersonal oriented psychotherapy. To summarize, consciousness expansion is a theme of humanity and needs to be seen as a human right as well as an ethical right for those in need to be able to access such kind of treatment. Consciousness expansion can support problem solving, personal development, supporting healing, mystical experiences, enhancing creativity, expanded sexual experiences, social engagement and interaction, ecological and environmental awareness, and might increase also activism. With such a perspective, we move beyond the reductionism of the Western medical model and science and beyond the body-mind-spirit split. And with such a stance to integrate substances in the treatment, we also move beyond the war on drugs. Is it time to end the war on drugs? Yes, it is time to end the war on drugs. A heart blown open. Thank you very much for your attention. You can find more about my work regarding healing work, research publication. Also other activities include shamanic expeditions, cultural exchange, etc. on my webpage www.drreginahess.com. Please feel free to shoot me an email at any time with any question you might have after this webinar. Send it please to dr.reginahess@gmail.com. My project is called ASI World Forum, that I have founded and that I am directing and currently developing further. More information you can find on my webpage www.drreginahess.com. My webpage drreginahess.com, ASI World Forum, Dr. Regina U. Hess International, Ancient Wisdom Meets Modern Science, is concerned with the conservation of ancient healing traditions and ancient knowledge, sacred medicine, integrative intervention, research, teaching, publication, art, film, shamanic expeditions, and cultural exchange. Ciao! Blessings, peace, love, see you, and feel free to contact me at any time.